Today we have Melissa Papi. Melissa is a breast cancer survivor. Melissa, thank you for coming and spending some time with us today. And we want to know a little bit of your story and what you went through with this whole ordeal. Melissa, at the age of 29, you become diagnosed with breast cancer. Tell me, how was your life prior to being diagnosed?
Prior to the diagnosis, I was very active and, enjoyed my photography very much. The diagnosis certainly halted a lot of my activity. Now that I am going through treatment, I have to slow down a lot, and hopefully after my treatment I'll be able to regain a lot of my strength and go on to finish my photography career.
Most of the people that get diagnosed are 40 and over, but nowadays it's something that is so common. And you being 29, were you aware of breast cancer, self-examination?
I was definitely aware of self-examination. I actually found the lump myself. I was on a way to my doctor's appointment. I had my annual set up, and then I proceeded to do the shower check prior to going into my appointment and found the lump and pointed it out to my doctor. From that point on, they put me into an emergency status because the tumor was so very large. So I went immediately December 13th from my doctor, went into emergency ultrasounds, emergency mammograms, and took off from there. I was in surgery by February.
Melissa, what were some of the symptoms that you experienced that were like, maybe this is just not normal, maybe I should go and seek medical help?
Well, when I did find the lump, there were calcifications, so it was quite hard, and it was about 2/3 the size of my breast. So at that point I had to go into an emergency action, and my doctors proceeded to send me in for ultrasounds and mammograms to send me into an emergency track for surgery.
You got diagnosed in December 2007, which was pretty recent.
Yes.
How were your holidays for you?
My holidays were quite stressful, to say the least. I was quite depressed, something I was not expecting to have to deal with. Luckily, I have my family as a huge support, so my family has been there. I've had my friends there with me, so they were able to help me through the holidays. And
it must have been pretty difficult for you to break this news to them.
Absolutely.
How did they take
my parents actually went with me to my doctor's appointments. So they were with me the entire time. They were very much involved with my surgeons and my reconstruction and the hospital visits. I had a lot of family and friends that were there to help me through.
What stage of cancer were you diagnosed?
Stage 2.
Stage 2.
Originally I was diagnosed with DCIS, which is ductal carcinoma in situ, and that is stage 1. After they went in and removed the tumor and they did the pathology report on it, they realized that it had actually advanced to stage 2, and there was a small tumor cell within the larger cell that, if not treated, would have gone into my organs.
It must have been so difficult for you to wait for a pathology test. It's like that you're waiting to know what your destiny is going to be holding for you just on a little piece of paper. It must have been the most difficult thing for you.
Absolutely. The time that I spent in the hospital was very difficult, but like I said, luckily I have a great support team of family and friends, so everybody came to visit me. I had stuffed animals and flowers and balloons, and everyone in the cancer ward was actually quite surprised because they said that they had never seen quite a turnout. They had to kick people out of my room in order for them to come do tests.
You had a mastectomy done this year, yes. February 4th.
Yes.
How was that day? How was the beginning of the day that you knew that you were going to have this cancer removed out of you? How were you feeling that day?
I was very stressed. However, I am a very faithful and religious person, so that helped me through. As they were setting me up and wheeling me through into the surgery room, I told them, let's hurry up and get this over with, and I'm going to go in there and I'm going to get everything out and just get on with my life. So that's exactly what I did. My parents were right by my side until they wheeled me into the surgery room, so I felt pretty secure and confident in my surgery team.
I don't think there's any better support than your family and your loved ones, especially when you need their support at their best, 100%. You don't have the strength, and it must have been pretty difficult for you. We currently know that you're going through chemotherapy,
yes.
which can take a toll on you. It's pretty difficult. How is it? For me, it seems so far away. It's something that you can describe it to a T, and many of us wouldn't understand what it's like.
Well, I have had difficulty because of my age at diagnosis. There has been quite a difficult time trying to find anyone to talk to or to relate to about my disease, because everyone seems to be much older than I am when they're going through this. So I have definitely had a difficult time with that. None of my friends obviously can relate. They try, but it's very difficult because they don't understand how someone of my age is able to get through this. I was very, very ill. I've had many toxic reactions throughout my chemotherapy, so a lot of the time I stay in PJs.
Which sometimes it could be beneficial, very comfortable.
Yes. It's fun to walk through the hospital and always wear my PJs and, you know.
And your excuse to do so.
Exactly.
Have you had to change your lifestyle? Obviously you've had. Your diet,
Definitely.
The way you used to work, as many hours as you used to work. What are the changes that you experience?
Well, my treatments and my appointments do take up a lot of time. So I tend to be between doctor's appointments and treatments and blood work and scans most of the week. I have gotten up to the point where I am actually going to work half days, about 3 days a week. I am a vet tech as well. The photography is on hold for the moment. But doing the vet tech work, I have found that I've done more reception stuff so that I'm not going to harm myself dealing with the animals. But it definitely has changed my life completely. But I'm trying to take a positive aspect of it and, you know, take the positive benefits.
That's what I wanted to ask you. In spite of the ups and downs that you've been, mostly ups and downs, crazy, can you tell me what has been the most positive and gratifying thing that you have gotten out of breast cancer, which sounds kind of odd, but have you learned to appreciate your life a little bit more, to take advantage of every single second that you have? What are something positive that you have gained out of?
I absolutely have tried to look at it in a positive light and have gained so much insight into the world around me, into personal feelings, into personal relationships. During my photography, I was in the process of creating a magazine. Now I have also taken that one step further and have learned to use my breast cancer to my advantage, and I'm making it a nonprofit organization so that I can help people that are going through the same exact thing that I'm going through.
Melissa, now that you're 30 and almost finishing up with this process, what would you recommend us 20s, 26, 27-year-old, that we don't really think about breast cancer as something that can hit us?
Self-examinations. I would definitely suggest self-examinations because, as I said, that is the way that I found my tumor, and I was the one who pointed it out to my doctor. So to self-examine yourself, you know, once a month is definitely the perfect way to, you know, keep an eye on it. And if you are able to convince your doctors to get a mammogram at such a young age, it is beneficial to go ahead and get a starting point so that you know if there's any problems along the way, that they can constantly keep an eye on that.
Absolutely incredible. One last fact that I wanted to share with the viewers is that 20,000 lives are claimed every year due to breast cancer. And the most astonishing part about it is that 4,000 lives are men. So guys, you should also get examinated. This is not only touches women, it also goes for men as well. So ladies, self-examination, and you can see that anyone with lots of willpower and positive thoughts can survive. It's not something that's going to claim your life nowadays. So do it early and get to a doctor soon. Melissa, thank you so much for coming and sharing your story with us.
Thank you very much. I was glad to be here.